come from. Short introduction. So Mattress was founded in 2015 by Professor Oberländer and team. We're located in New York City and in Cologne, and we develop cloud-based biomechanics and AI solutions for the world of sports and for healthcare. And we support big brands such as Ottobock or Essex with their customers' digital experience. So first questions for Professor Oberländer. Kai, how did you actually get into the field of biomechanics?
Oh, Dietmar, I have to start in the early 2000s, where I studied mathematics and sports science. And in the combination of these two subjects, I found my passion, which leads me to biomechanics. I was fascinated about the fact that joints allowed the segments attached to it to move on circular paths. However, human locomotion by itself is more nature of linear movement. So I started reading books from Neil Alexander about animal locomotion, and that brought me to biomechanics.
Great. And what brought you the idea to move from the academic field to the world of business, such as developing IT solutions that help people buy great stuff or have a good healthcare treatment?
In the late 2000s, I moved to Cologne to start my PhD about the knee health status after ACL reconstruction. I worked together with internationally well-known surgeons, which influenced me positively in the ways that I see human locomotion more in a way from a human perspective than from a mathematical perspective. However, in this orthopedic environment, it's hard to predict the outcome of a surgery. It's hard to make objective judgments if you can go back to sports. If you need an orthosis, for example, which protects you a bit longer in the recovery process. And we try to develop technologies which makes the judgment if you can go back to sports easier. It was not available in these days. We're sitting here in a lab with a lot of high expensive equipment, but you cannot bring that to the clinicians. So the idea was to help the clinicians, to help the people in the real world using biomechanics methods in their environment. And that was the beginning of Mattress.
What we will learn is that Mattress has already recorded loads of motion data, big data that is now in the Mattress cloud, and that helps make judgments in healthcare situations, but also in sports situations. And what we found is that this motion data is the new gold in data mining of big data in the health industry. Because if you compare it to other sources of data, this is first-hand data. So we record it in motion with the patient or the client. And also it is derived from a non-invasional method. So it's very easy to do and it's not painful or complicated for the patient. And also it allows us directly to access certain locomotions that the patient needs for his sports or for his health. And where it's possible to predict certain outcomes in diseases. Is that right?
That's right. We started 2 years ago a multi-center study with 4 big clinical partners here. And the goal was really to make an estimation of the future of your health status in terms of orthopedic diseases. So we captured a lot of data with sensor attached to your body in clinical environments to calculate your locomotion characteristics, finding values which describe exactly how you walk, how you behave. On the other hand, we ask a lot of questions to understand, for example, the osteoarthritis level of your knee joint. Now we have the both sides. We know how a patient walks. We know about the health status of a knee joint, that's to say the osteoarthritis level in our case. And we can match this and find the best values to describe the locomotion characteristics, which predicts the health status. That's the first step. Once we are able to do that, and we are at the moment at a point where we can predict this with about 70% accuracy, so we can measure your motion and predict the health status of your knee by 70% accuracy without X-rays, without MRI, which is amazing. And with that information, we can then start to predict the future. If you walk today like a handicapped person from your locomotion characteristics of arthrosis level 4 in your knee, or 3, let's say 3, but you have no pain, it's most likely that you progress in that direction. So that's what we are doing at the moment, trying to predict the future of your health status. And therefore you need a lot of data good methods, good mathematics, and good biomechanics understanding.
What we will see a little bit later on is how we actually record this data. For at the moment, we are on the treadmill that's normally used for athletes to do their run analysis. So as this is quite easy to do, as we will learn, with like sensors that we can attach, yeah, or sometimes also by video data, could that also be a perspective for like home analysis of people who live in their normal home environment and see how they progress? Also things where we don't have the big machinery and equipment of a hospital.
I think the first step is that we do the diagnosis by having sophisticated methods available, easy to use. And the second step is the intervention. What are you doing? What are you doing with the results that there is a progression of knee joint degeneration in the future? You have to do intervention. Intervention can be, on the one hand, physical therapy, whether at a club or at home. And at home, you need some feedback systems which helps you to perform the movement in the right way. And therefore, you can also use the technology which we are using for doing the analysis.
I just learned from an athlete, Jan Fitschen, who was here yesterday. He did the run analysis and he's been Euro champion for 10,000 meters some years ago. And he said it's the first time that he gets some advice what training schedule and what exercises would be good to improve this. Is this a first step also into like individual coaching and therapy, both for sports people and patients alike?
I think it's the first step in a way that we do an objective recommendation in the right way. You know, these running analyses are carried out since many years, but most of the time it is a subject rating, that someone is judging how you should run, how you should behave, and making a ranking, a scoring, an easy explanation. What we try to do, which is much more precise, is that we really taking into account your own limits, what you can achieve with your body, matching it to normative data, which is unique and which is really hard to collect. You know, getting 100,000 people in your lab, or it's not so easy. But once you have this, you can cluster it and you can find a similar person like you in the database and can comparing you to a most similar person of you. So having you matched against a similar person in the database. And that can then lead to recommendations which are far beyond subjective ratings. Yeah, okay, put your food like this or that is subjective rating. We put it against a database and make the recommendation based on big data. And this is something which it was not possible years ago because there was no data available. The methods which are used were not sophisticated to do that. The statistic model were not ready. Nowadays we're talking about AI and machine learning. It's just a statistic approach to get information and make a prediction. Yeah. That is changing nowadays.
So thank you. Now we will take a deeper look into 3 use cases where we can see how we actually create this value out of motion data and apply this to the world of sports, to the world of healthcare, and maybe also to how we find a good sleep at night after our exercise. So now we come to the first use case of the technology that Mattress develops, and it's a medical use case in place already in hundreds of workshops of Ottobock and Ottobock's business partners around the world. Kai, when it comes to the gait analysis in the orthopedic workshop, what is actually the benefit the solution delivers to the patient?
The benefit is that the adjustments which are made to the orthopedic helping devices, like an electrostimulation device, which helps you to lift up the foot, for example, is that this tuning of those devices are much more precise. It helps you to recover a more normal gait characteristics in a shorter time in this environment. A few years ago, the judgment was done by the operator of the system, by the operator of the shop, tuning it, changing settings of these devices, which were based on the experience which he had had or she had had in the past. With the change of generation, the people who can feel it with their hand and make the judgment based on their history, they are no longer available in the shops. Yeah? So the new generation is there, which learned different parts during their study. Yeah? They learned business. They are not used to do it by their hand anymore in a way how it was done in the past. And here the system, our technology solution comes into place. We're helping to provide parameters which makes the judgment if the setting of this orthesis is right out of the box and make it available for the operator of the shop.
So the patient gets support here to get the perfect individual orthesis for his and her walking behavior, and afterwards comes back to more natural walking behavior, right?
That's the goal. An analysis is done without an orthesis to find the deviation between normal walking and handicapped walking. With the orthesis, it should improve. You should walk with the orthesis more like a non-handicapped person. And therefore, you need to adjust the orthesis. You need to adjust the point where the electrostimulation occurs, for example, to bring you into a more natural walking characteristic. That's not an easy job.
You said that we have lots of data, and also there's machine learning and AI helping finding the patterns here. So this is a more standardized and scientific approach to solving this problem?
It's a more standardized and sophisticated approach, yes. Machine learning comes into place to make the product more robust, for example, because the walking characteristics which we see at the handicapped patients are sometimes so different from normal walking characteristics that classical algorithms are not being able to quantify, for example, when the foot is on the ground or even lifted up, because it's so disturbed walking characteristics. And here we need machine learning to make the product more robust. Yeah? This is when machine learning and big data comes into place.
So as this solution is now already in the field at Otto Bock, it's called Bionic Pro. We can say this can be easily installed without a big affair in every orthopedic workshop around the world, right?
Comes out of the box, up and running, and you can use it. Yeah, and also the analysis is just after a short tutorial being able to do. That's the most important part, that it's easy to use and easy applicable in the daily routines in these shops.
And as this is joined in the big cloud of Motesk all around the world, this means also this is free of maintenance, so all the updates come through the cloud. So this is like a frictionless service, so to speak.
Yeah, that's important. You know, we like to do proactive support, meaning we like to do the updates, we like to do the help if there is help needed with the technical system, meaning there's a technical problem, for example, which should not occur. But if it's occur, we have a proactive support and can reach out to the clients and can help them even before they know that there is a problem. That's the cloud connectivity, yes.
Actually, this technology could bring big benefits to medical workshops, but also medical centers all around the world and help patients find a more natural walking or running behavior. Now we leave this world of orthopedics a little bit because there's already another application of it. So if you went to an Essex flagship store to find the perfect running shoe, you might have used also Motesk technology. Is that right?
Yeah, that's right. That was indeed one of the first customer where the company was born with. We started Motesk after signing the Essex contract a few years ago. It is a project where I'm very proud of because we as a young startup made it into a retail environment, which is really hard work. We applied technology to judge which shoe is the best, which shoe fits the running style the best. So you attach the sensors, you run on a treadmill, you wear a shoe, we judge the shoe if this fits your running style. We predict that another shoe could even do it better. You run the other shoe, you got the confirmation, and you have a good sale, you have a good product recommendation, which is at the moment occurring around the world, post-pandemic again.
That's fantastic. So also here you have collected the data, anonymous data, so everyone is protected in terms of GDPR and data security. But this data can also help athletes and also normal runners to improve their running style because you can also give recommendations, right, for trainings and exercise?
That was the goal, to have this consolidated database that all devices sending the data are normalized in the cloud and we can find the pattern behind normal running, behind different kind of shoes. And with that information, what is a normal runner? So we know the age, we know the weight, we know a bit about the legs, if it's X legs or O legs. We know how much a runner runs normally in a week, and then they perform the analysis. So we have a lot of context information together with locomotion characteristics. And with that, big, huge database, 120,000 runners at the moment, I guess. It's a huge database and we can predict what's normal, what's unnormal, and we can make judgments out of it for the future.
Due to the pandemic situation at the moment in May 2021, we see that many people take up outdoor sports. We talked about running, and Motesk is helping people run more healthier with better equipment and with the right training. But are there also other sports, maybe in the outdoor environment, that your technology could support?
The bicycle sector is a huge sector where we can really bring biomechanics, helping people to find the right bike frame size, for example. We can adjust seat positions and handlebar geometries to really get you better on the bike. That's something which we are doing.
So we have seen in the discussion with Kai that there are many applications of using motion data, big data, machine learning, and the right applications to bring value to the patients in the orthopedic workshop, but also to runners and cyclists all around the world. Now we come to the third and last application of using this technology, and this is totally different. What recent studies have unveiled is that many people, especially in the age between 20 and 60 and further on, have problems with finding the right sleep at night. And that 50% of those people, as revealed by studies of Techniker Krankenkasse and the DAK, have shown to have muscular problems that keep them from sleeping, but also can cause chronic diseases. So solving the sleeping challenge could be a big application both of motion data and other data. So there might be a solution for it. Kai, how did you venture into the field of sleeping and finding the perfect mattress for each individual?
Yeah, let me repeat a friend of Motesk. Train hard, rest harder. And we are a company doing analysis of locomotion, doing recommendation based on insights which we gather. On the other hand, you need to rest. Rest or sleep is taking about 1/3 of the day in our daily life. Yeah, we're sleeping 7 to 8 hours a night. And a lot of orthopedic problems occur if you're not sleeping right. Your neural nervous system is not recovering right if you're not sleeping right. So sleeping has a big impact of our health status, of staying healthy. So we deal with sleeping because sleeping is a state of motion. It's the rest of motion is a rest state. And we do the analysis of mattresses in order to find the right mattress for you. How we do that? So we're taking pictures from you. We're fitting a 3D avatar into those pictures, which is a virtual representation of yourself. We know the geometry, we know the masses, we do a physical simulation. We're placing you on different mattresses and calculate a whole night of sleep, how your spine is deforming, how the pressure points are under your shoulder, for example, and can predict and do a recommendation based on biomechanics model what is good for you or not. We ask you some questions. Do you have back pain? We rate the spine geometry during sleep higher. Do you have diabetes? We will rate the pressure points higher under your shoulder, which are calculated with a very sophisticated physical approach.
Yeah, that sounds quite complicated because there's lots of going on, simulations with several mattresses. So think of you would like to try all these mattresses for one night and have them delivered to your home and delivered back again. So this is quite complicated. But what does it actually take if someone uses the app? Is that complicated?
The goal is to have it done pretty easy. Just give us 2 questions, answer 2 questions or 3, take 2 pictures of you and that's all. And then the magic occurs in the cloud, in the software, in the system, in our solution. The complicated part is not on the user side, the complicated part is on our infrastructure side, in the cloud environment. We're doing hard physical simulations, soft physical simulations with constraints. It's really something which you normally use to do a physics simulation of flying to the moon. Yeah, that is ongoing to solve a simple mattress problem. Yeah.
Okay, so we can also see that the mattresses are actually tested here at the Mlab in Cologne, and all this work comes into this solution. And for the user, it's just 2 or 3 clicks and sending 2 pictures over, and then something which would take maybe weeks or months, testing out mattresses, can be done on a physical basis, on a scientific basis, in a simulation that uses machine learning and artificial intelligence in the cloud in maybe 15 to 20 seconds. So this is a big advantage.
I even believe that doing a test sleep at a store, as a physical retail store, is not giving you such a precise recommendation like we can simulate. Because in the store, normally you lie down for 2 or 3 minutes and then the next customer is already waiting, for example, you cannot relax. And the mattress is changing its mechanical properties in the first 30 minutes strongly because it's a viscoelastic material. It changes based on temperature, based on how much you penetrate the mattress with your shoulder, for example. So it's changing its mechanical configuration during the first 30 minutes strongly. Ask yourself how long you do a test sleep or a test lying down in IKEA, for example, or other stores. It's a minute. then you got a feeling which is not representative for your sleeping. So the simulation takes really the whole night into account, that you're heating up the mattress with your body. Then the mechanics are changing of the mattress. So it's really something which you nowadays can, I would bet on it, not do in a store. And a few years ago, you would not have the time to do it.
Thanks a lot. So we have seen that the application of technology helps already in the medical world at Ottobock, or in the running world at the Essex flagship store, and actually might help you find the perfect mattress soon. So these are three very different applications of this technology that already work outside. So Motesk is already delivering a lot of value to the world out there. To understand what you have on your mind, we are now open, Kai and I, to take questions. So please shoot your questions and we will answer them soon. If you need more information about the technology, you can also write us an email to contact@motesk.com. And please visit our website www.motesk.com, where we have blog articles, webinars, and where we have more information about the world of Motesk technologies, its clients and application. Thanks a lot. So we are at the Mlab live here with Dr. Kai Oberländer. My name is Dietmar Hagen Horn. So we are ready to take questions from all of you. I'm looking at the questions panel and I see the first question, which is directed to Kai. Kai, we've seen that there's lots of technology here for gait analysis, run analysis. Is it possible to use some of your technology also outside from the laboratory environment, more like in the home environment for diagnosis? Is it robust enough? Does it work?
Yeah, the technology we built up around our motion analysis kits are suitable to home environments, to use inside the lab, outside the lab, at home. So that's important. That's a portable device and you can use it almost anywhere.
That's great. So the next question goes into the same direction, I would say. I need to read it, sorry. The next question is with the pandemic situation that people cannot move to doctors' places and it's a no-touch situation. Do you see more applications forthcoming where people actually use online technologies for determining diagnosis, or like your sensor kits in home environments? Is there a wave of new applications coming?
Yeah. You know, at March 2020, everything changed. For example, here in Germany, a few weeks before, it changed other countries. So the behavior of the people more restrictive to touching each other. So they're taking more care at the moment. I believe that this boosts a natural development which was already ongoing. It just speeds up the development in home-assisted care systems or self-diagnosis systems. And like we, others are already working on solutions, bringing the doctors at your living room with smartphone applications or sensor technology which you can rent. So I think this is really the next step of IoT devices, camera-based systems, sensor-based systems, that they are more and more part of your daily living, that you can do it at home, so that you can reach out to an app which gives you recommendations and escalates to a doctor if needed. So I think this is already ongoing and it will continue. But I would not say the pandemic was the main driver for it. It was just speeding up this development.
Okay, so we will see more and more of these applications.
Yeah.
So overall, we must say that the medical ecosystems probably will change, because also in a crisis, you see that there are no new possibilities. So we see also that people take their health more in their own hands. So the next question is about more about the people's ability to use this technology to prevent becoming ill. Do you see also a trend here that people more and more develop their own responsibility for their health and use systems to improve their health?
Yeah, I believe it already starts a few years ago with the smart trackers, which is counting your steps, giving you indications that you should move a bit more, maybe to lose weight or to have a more healthy cardiovascular system. Then there was also this IoT smart scales, which measures, for example, body composition of fat and muscles. This all goes in the direction that you take care of yourself. And the next step is really to bring devices into the hand of the customers that helps them to do sort of self-diagnosis about body posture, about, for example, we by ourselves did a big study which goes in the direction of knee osteoarthritis, preventing the progression of knee osteoarthritis by intervention programs which are semi-automatic and automatic detected. And then you go home with this diagnosis and has to adjust your walking characteristics, for example. This is a continuous process. This cannot be done in the physiotherapy alone. It also needs to be at home. And we are developing tools which helps you at home to remember what you learned during the physiotherapy. I think this is a big development where the responsibility is more and more in the hands of the patient, of the customer.
Okay.
But the industry and the doctors has to provide those tools.
Okay. So trying to read the next question. So this is more about the title of our session, like why motion data is the new gold. And I think the background of this question could be health insurance. The question is the data that you collect when working with athletes, but also with patients. Is it anonymized, and can this data used by, for instance, health insurances to improve their offerings and help their members to improve their own lifestyle? Is there a possibility to use the anonymized data to the welfare of people?
Yeah, first, I have to state and mention again that we only collect data on a anonymized way. So everything what we do is GDPR compliant, and that's really the basic to do the next step. Yeah. So we have collected a lot of data in the past, which can help us to develop models for predicting health status, for example, to work together with a health insurance company to monitor the progression of rehabilitation, for example, or to predict the future and do early interventions with the customer or the patient in that case. Yes, I think there's a big opportunity, and we, in our company vision, we have one of the next steps is to use that data in a more broader way, to work closely together with the other industries to make recommendations which predicts the future and helps the people to stay alive, to stay healthy. They will stay alive. They should stay alive. To stay healthy. Yeah.
Okay. Great. So,
if I understand the question correct, I think
I think it was correct. So, next question is also around the data. It's more, I know, it's more like a technical background. So the person says, I assume this data that you collect from so many people with the sensors or also video is a huge amount of data, like big data. So how is it possible to store this data? And how can you drive value out of this data? So what do you use to make this, I would say, general data into something that is meaningful for both patients or doctors or institutions?
So it's a bit a technical question. So all our devices and our services are, let's say, connected to a centralized database, which is a cloud. The word cloud is very generic, but it is a data storage cloud and a computation cloud. All the devices in field send the data to the centralized database, where we collect all the anonymized information. And from that database, we can move the data to computation clusters, which do, let's say, machine learning approach to extract key informations out of the data, which is then used for recommendations. So it's a recommender system, let's say it like this. So we extracting features and predicting and recommending based on the information of this huge collected database with healthy and handicapped patients inside different scenarios, let's say it like this. And that can then be, this information can then transferred or embedded into other applications which don't need to be cloud connected, for example. But they can use the data and the models which we create in the cloud. So it's a machine learning. It's a big database, and you need a lot of data to drive machine learning models to be precise. So it's so-called supervised learning, where we use convolutional neural networks, for example, to extract features and make use of it.
Good, thanks. So next question is also around the data and the use of it. So in the title it says that it's not just the data, but also artificial intelligence. Does the artificial intelligence need to be provided by the users, or do you already have like artificial intelligence, machine learning in place to create those models and use it for medical purpose?
Yeah. The infrastructure is up and running, so we already do this, but we adjust the models to certain use cases. So we have a huge database, for example, and models for predicting the health status of the knee. Yeah? We know your locomotion characteristics, we drive the information about the osteoarthritis level of your knee. This is up and running, so but it's adjustable. You know, the goal of this data is to answer specific customer needs, and we are able to, let's say, customize certain levels of this infrastructure to meet the customer needs.
Okay. Yeah, and another question, is this limited to certain medical use cases, like orthopedic use cases, or could this technology also be used to detect like neurodegenerative dysfunctions that show in the motion pattern?
Yeah. In general, yes, it can be used. So because the database, for example, where we collected data, have orthopedic patients inside, neurological patients inside, patients with amputees, healthy people who run, do normal movements. So we have a variety of information available to answer the questions.
Okay, good. So a last question that I have here. So the last question is, you were talking about the Mlab. The person says, I assume it's the place where you're sitting. Is this Mlab also open for like corporations or developing products together? Is this also a research facility that could be used in a cooperation?
Yeah, you only see a small area of the lab which is behind us, but we are sitting here in a, let's say, 200 square meters big environment with a lot of technology insights, which we first use for our own in-house developments, and what we also for the developments which we do with big partners together, like with Otto Bock, for example, or Essex takes place here. And we have also an open door for external parties who want to participate in our developments and also want to, for example, rent this room for doing their own research stuff. So we have collaboration with universities. So this is an open space, let's say, for exchanging ideas and trying out and developing things.
Okay, thank you. So those are the questions that I could see. So if you need more information, you can go to www.mortesk.com. We have a blog section also with articles about artificial intelligence, about sports, healthcare, and other things that we touched today. So I will ask, so we have no further questions here on our side. Puria, do you have any questions, or how shall we proceed?
Yep, we don't have anything coming up. I think we shall proceed.
Pardon? Okay, so we're finished with the questions. So if there's no further things to do, we wish all the participants, we want to say thank you for participating in our session. Please visit us in Cologne at the Mlab or on our website www.mortesk.com, and I wish you a great conference. And if you have any questions, you can also touch base with Kai and with me via the giant communication, so via the networking system. Thanks a lot, and we wish you a great day. Bye-bye.